Molecular classification of the breast cancer. So firstly, we are going to look at the luminal type A. In terms of luminal type A, it is the most common. It has the best prognosis and has presence of the mutated gene, that is BRCA. This is 2. Now looking at the receptor status. This involves the ER, PR positive, HER negative, and Ki67 negative. That is, it is less than 14% and it is low. Now looking at the histological subtypes, it can include the lobular, the mucinous, tubular, as well as papillary. Next, we are going to look at the luminal type B, and this is HER2 as well as NUU negative, and these are the mutated gene, that is BRCA2. Now the receptor status, it is the ER or the PR positive. Next, the HER2 is negative, and the Ki67, it is greater than 14%. So now looking at the histological subtypes, it is poorly differentiated, as well as there is lobular carcinoma. Next, looking at the luminal type B, this is nothing but the HER positive. Here the receptor status is the ER, PR are positive, HER2 is positive, then the Ki67 is variable. Now moving on to the HER2, this is enriched and it is the mutated TP53. Here the receptor status, it is ER and PR is negative, the HER2 is positive, and the Ki67 is simply high. Now here looking at the histological subtypes, it includes the apocrine as well as the micropapillary carcinoma. Next, we are looking at the basal type. Basal type is also known as the triple negative. It has a triple negative, and there is the mutated BRCA1. So here the ER and the PR are negative, and the HER2 is also negative, and looking at the Ki67, it is high. Now what are the histological subtypes? This involves the presence of the medullary carcinoma, involves the adenoid cystic carcinoma, this presence of the secretory carcinoma, as well as the metaplastic carcinoma.